Hello, welcome to the informational video to learn how to organize your medicines. My name is Judy Viduya and I am on the pharmacy transplant team here at UCSF. The goal of this video is to provide tips to help simplify your complex medication regimen. To do so, I will provide tips to stay organized as well as teach you how to accurately and efficiently fill your pill box. I will be using a pill box for this demonstration, but these techniques could also be applied when preparing your medications for the day. Remember, this is an example. Your medications and directions may be different than mine. Soon after discharge, you may find that using a pill box works best in organizing your medicines. As you are recovering from surgery and adjusting to the medicines, the directions for some medicines are likely to change. Because of this, it is best to start filling a pill box with only 2 days at a time. With frequent blood draws, your transplant team will adjust the doses of your medicines accordingly. A good rule of thumb is, when your blood draws are about 2 times a week, fill up to 2 days of your pill box. Then, when your blood draws are once a week, fill up to 7 days of the pill box. Finally, when blood draws are 1 to 2 times a month, fill up to 2 weeks at a time. As a reminder, because we will be handling our medicines, be sure to wash your hands with soap and water for at least 20 seconds, then dry them thoroughly. If a friend or family member will be assisting you, please be sure they are wearing gloves. Storing many medications could be overwhelming, so here are some ideas to stay organized. I recommend clearing a shelf or tabletop to place the prescription bottles. Ensure they are not in the bathroom where it gets too steamy, and confirm they are out of reach by children. Some prefer to have the prescription bottles in a storage bin like this one, or a cabinet or drawer. Just ensure they are accessible by you and whomever may be assisting with your medications. To begin preparing your daily medicines or preparing your pill box, we recommend lining up all the bottles numerically to stay organized. Remember, each bottle has a number that is associated with a line on the medication card, so lining up the bottles numerically will make the process easier. So starting with this first bottle, labeled number 2, we can start our line. Then, with this next bottle, labeled number 5, we can add it to our line of bottles. Continue lining up the bottles by number until they are all lined up. Feel free to pause the video here to sort your pill bottles into numerical order. With all the pill bottles lined up and in numerical order, we can begin filling the pill box. Let's spend some time reviewing the medication card. Please note this is just a refresher. To gain a more comprehensive review of the medication card, please see the Understanding the Medication Card video. Starting at the top of the medication card, please confirm that the card has your name on it. Next, remember that on each line there's a number next to the medication name, followed by the strength of that medicine for each dose, and also an X indicating when to take the dose. There may be multiple X's on the row, indicating that the medicine will be taken more than once in the day. Finally, the notes section may include some important information regarding the purpose or things to remember regarding the medicine. As a reminder, we will always reference the medication card to determine the dose and when to take our medicines, not the pill bottle. It is your responsibility to make changes to the card when notified by the transplant team. We will go into more detail when we begin filling the pill box. Looking at the pill box, there are a few things I'd like to point out. Firstly, your pill box may look slightly different than mine, but there are some important features it should have. For each day, there should be 4 sections in the pill box. For breakfast, around 9 a.m., lunch, around noon or 3 p.m., dinner, around 6 p.m., and bedtime, around 9 p.m. It is important to have 4 sections on each day of the pill box, as some medications may be taken up to 4 times a day. Some pill boxes with only 2 sections for AM and PM will make it challenging to sort our medications appropriately. Now that we've reviewed the medication card, pill box, and have our pill bottles ready, let's begin. To get started, let's look at the medication card, row number 1. Remember, your card may look slightly different than mine, but the process will be the same. Row number 1 on my card is prednisone, and the dose is 20 milligrams to be taken at breakfast every day. Next, let's obtain the first bottle. It should have a circled number 1, and its contents are prednisone 20 milligram tablets. It's important to confirm the medication name and dose match before proceeding. So a few things to consider. Is this the correct pill bottle? And also, does the strength of the tablets or capsules in the bottle match the dose that I need on the medication card? Remember, initially we will only fill the pill box for 2 days at a time. If today is Sunday, I'll fill the pill box for Monday and Tuesday. Prednisone will be taken every day at breakfast, so let's open up all the spots on the pill box for the breakfast time or 9 a.m. slot. We confirmed the contents in the pill bottle, but did it match the dose on the medication card? Since the tablets are 20 milligrams and the dose on the medication card is 20 milligrams, we will only need a single tablet of prednisone each morning. I find it easier to obtain the tablets from a small bowl or a cap, and then I can put them in the Monday and Tuesday pill slot. Once done, I recommend flipping the bottle upside down or placing it back into our storage bin. Now, prednisone is complete. Number 2 on the medication card is mycophenolate. The dose is 1,000 milligrams to be taken at breakfast and bedtime. The next bottle is mycophenolate, and the capsule strength is 250 milligrams. So, how many capsules of mycophenolate will you need to make a total dose of 1,000 milligrams? If you said 4, that's correct. So at breakfast, we will need 4 capsules. Then at bedtime, we will need another 4 capsules. In total, each day requires 8 capsules of mycophenolate. Let's continue by filling the pill box for both Monday and Tuesday. Once complete, remember to flip the bottle upside down or place it back into your bin. Now, mycophenolate is complete. Let's practice a third time with tacrolimus. Remember, this is a sample patient, so your dosing may be different. Please follow along with your card. For this patient, the dose is 1 milligram at breakfast and 1.5 milligrams at bedtime. Tacrolimus is tricky because there are 2 separate prescription bottles. You should have a bottle of 0.5 milligram capsules, also labeled 3A. The second tacrolimus bottle contains 1 milligram capsules and should be labeled 3B. The 2 strengths are used in combination to ensure the right levels of tacrolimus are in your body. In addition, tacrolimus is made in a capsule, therefore it cannot be cut in half. Let's begin filling the pill box for Monday and Tuesday. At 9 a.m., we will need a single 1 milligram capsule. Because the doses are different, let's start by filling the pill box with the breakfast dose. The bedtime dose is more complex. It is 1.5 milligrams. How should we prepare 1.5 milligrams of tacrolimus? 1.5 milligrams of tacrolimus can be made with either 3 of the 0.5 milligram capsules, or it can be prepared with a single 0.5 milligram capsule plus a single 1 milligram capsule. I recommend using the 1 milligram capsules first, then completing the dose with the 0.5 milligram capsules. This ensures you will not run out of the 0.5 milligram capsules. Let's fill the bedtime tacrolimus dose for Monday and Tuesday. Remember, we will be using a single 1 milligram capsule plus a single 0.5 milligram capsule for the total dose of 1.5 milligrams. Again, once we're done with the bottle, flipping it upside down can help minimize confusion. And now we've successfully prepared tacrolimus in the pill box for Monday and Tuesday. Let's practice making different combinations if your medicine dose changes. If your breakfast dose is now 2 milligrams and your bedtime dose is 2.5 milligrams, how will you make this dose? For the breakfast dose, we could use 2 of the 1 milligram capsules. What is the best way to prepare the 2.5 milligram dose of tacrolimus? 2.5 milligrams of tacrolimus can be prepared with either 5 of the 0.5 milligram capsules or a single 0.5 milligram capsule plus 2 1 milligram capsules. This option is preferred to ensure that we do not run out of the 0.5 milligram capsules. Please pause the video here to continue filling your pill box for the remaining medications on your card. Throughout this video, we walked through methods to stay organized and use a pill box. There are a few things I'd like to mention again as a reminder. Firstly, let's return to the topic of how many days to fill the pill box. When you are initially discharged, begin by filling the pill box for only 2 days. As your body adjusts to the medicines, your healthcare team will adjust your medicine doses. As a good rule of thumb, once your blood draws are more spaced out, you can fill the pill box for more days. Next, you may have noticed that we follow the directions on the medication card, not the pill bottle. As doses change, the pill bottle may not reflect that change immediately. The directions on the pill bottles are simply not up to date. Because of these changes, please follow the up-to-date directions on your medication card. Some medications cannot be stored in a pill box. For example, Ambisome must be stored in the refrigerator. Other medicines like sublingual tacrolimus or alendronate cannot be stored in a pill box because the administration requires them to be separate. In addition, some medicines are to be taken as needed. Because these medicines aren't used regularly, they should not be filled in a pill box. Finally, let's discuss refills. When you notice you have 7 to 10 days worth of medicines left, please contact your local pharmacy to schedule refills. It is important to do this before you run out of medicines. For your safety, at no point should you be without medicines. Lastly, remember the pharmacy will not number your bottles to match your medication card. This is your responsibility with refills. Thank you for your undivided attention. We hope this video was helpful in promoting organization when managing your medicines after discharge.